Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to dive into Calcipotriene. This is a topical prescription medication and it is synthetic derivative of vitamin D, used primarily to treat a condition called psoriasis. Now, psoriasis is a chronic skin condition where the skin cells build up way too fast, leading to these thick, scaly, and sometimes itchy patches, often found on the elbows, knees, and lower back. Calcipotriene comes in and helps slow down that rapid skin cell growth, so your skin can feel and look more normal. The way this works is by calming down the overreactive immune system response that's responsible for causing the skin cells to multiply so quickly. And since it's a vitamin D analog, meaning it mimics what vitamin D does in the body, it is specifically good at targeting those thick patches of skin. You may have heard of the different brand names for calcipotriene, like Calcipotriene, Dovanex, and Sorilux. These come in various forms like ointment, cream, foam, and solution, so your doctor may prescribe whichever one works best for you. The most common conditions we treat with calcipotriene include plaque psoriasis, and if you have scalp psoriasis, which is similar but affects the scalp, it's especially helpful. You might notice red, scaly patches under your hair, and treating it early can prevent symptoms from worsening, like itching or even hair loss. When it comes to actually applying this medication, it's super important to use it exactly as prescribed. Usually, it's applied once or twice a day. Consistency is key. You'll likely see improvement in a few weeks, sometimes between 2 to 8 weeks, but don't rush the process and don't stop using it unless your doctor tells you. Things should be kept under control to prevent flare-ups. Now, how you apply it depends on the form you're using. For instance, if you're using the ointment, make sure to wash your hands before and after applying. Apply a thin layer to the affected area, gently rubbing it in. Avoid putting it on your face or areas with thin skin like around your eyes or genitals, unless your doctor says otherwise. You want to be mindful of how much you're applying because overusing it can increase your risk of side effects. Speaking of side effects, let's talk about those real quick. It's pretty common to feel a bit of skin irritation like redness or a burning sensation, especially when you first start using it. If you notice things like itching, peeling, or dryness, that's fairly normal and often improves as your skin adjusts. But if it doesn't, or if it gets worse, make sure to reach out to your doctor. More serious side effects, though rare, can happen if you use too much of the medication. Since calcipotriene is a synthetic vitamin D, using it excessively can lead to higher calcium levels in the blood. This could result in symptoms like nausea, vomiting, muscle weakness, or even confusion. So definitely stick to the prescribed amount and don't try to make up for missed doses. And if you do happen to miss a dose, just apply it as soon as you remember unless it's close to your next application. In that case, skip the missed one and don't double up, as overuse can lead to irritation or more serious side effects that we mentioned. While using this medication, it is also important to limit your time in the sun. Calcipotriene can make your skin more sensitive, so you're at a higher risk of sunburn. And be sure to avoid tanning beds or any kind of artificial UV exposure while you're on this treatment. So just to wrap it up, calcipotriene is an appropriate option for managing psoriasis. It's easy to apply, but it is important to follow the instructions and watch for any unusual symptoms. And of course, always reach out to your doctor if you have any concerns or need advice on how to get the best results from your treatment. You can read more about calcipotriene and psoriasis on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.